And welcome back to Channel 13 News. I am your host, Michael Fernandez. Today we have a very important story that we're addressing regarding the VA and the full authority practice for CRNAs. Today I have with me 4 excellent CRNAs from the AANA Subcommittee on Government Affairs Division. They will be discussing the strengths, weaknesses, opportunities, and challenges that the government officials face when trying to pass full practice authorities for CRNAs in the VA setting. So today I have David Hernandez, Lindy Bailey, David Perez, and Austin Miller is here with us today. How are you doing today, guys?
We're doing good.
Thank you for having us.
Excellent. So to get us started, David, can you give us a little background on CRNAs and what their practice is like right now?
Absolutely. Thank you for having me here, Mike. Look, CRNAs are anesthesia professionals who safely administer more than 50 million anesthetics to patients each year in the United States. They're among the nation's most trusted professions and ranked second in the 2021 U.S. News and World Report's Best Healthcare Jobs. Numerous peer-reviewed studies have shown that CRNAs are safe, high-quality, and cost-effective anesthesia professionals who should be practicing to the full extent of their education and abilities. CRNAs are qualified to make independent judgments regarding all aspects of anesthesia care. Michael, to date, 19 states and Guam have opted out of the federal physician supervision requirement. Moving forward with the CRNA full practice authority means an expansion in access to anesthesia care, which includes the utilization of thousands of CRNAs in the VA system. What we're looking forward to here, Mike, is what we call the CRNA model, where anesthesia delivery is staffed and directed by CRNAs to avoid duplication of services, promotes efficiency in the utilization of anesthesia providers, and overall a reduction in cost. As of April 21st, 2020, 30 states have already adopted the Veteran Health Administration temporary guidance on allowing CRNAs to have full practice authority within the scope of their license in providing anesthesia care. This all came about due to COVID. What we're calling upon the legislators and the VA to make this policy permanent, granting full practice authority to CRNAs in VA facilities in every state to expand access to important anesthesia services that our nation's veterans will need during COVID-19 and beyond.
Thank you, David. Thank you very much for that information. So, Lindy, we are having, why are CRNAs right now having such a tough time moving forward and gaining more responsibilities? Can you tell us a little bit about that?
Yes, Michael. There's one big aspect of why CRNAs are not able to move forward, and this bill cannot be passed to allow CRNAs their full scope of practice. And this is that government officials, legislators, and the public lack sufficient knowledge on what a CRNA is, their education, their training, their clinical experience that they have had through their educational process and beyond. And they also lack knowledge on their scope of practice, all of the techniques that they know how to do, and how many clinical cases that they actually have to do before they're able to get their licensure. So due to this, we need to educate our legislators and our government officials and the general public on what a CRNA is and why they are safe and how they are educated properly to do the same job as an anesthesiologist.
Very excellent, excellent. David Perez, tell us a little bit about the benefits that full practice would have on CRNAs, and is there any data that you can provide that might sway legislators to grant that practice?
Absolutely, Michael. Thank you for having me. I want to point out something that will be beneficial for legislators to know, especially to serve better their constituents, military personnel, and VA veterans. So granting full practice authority to CRNAs in the Veteran Health Administration would enhance the quality of anesthesia care provided to millions of veterans. Opportunities such as reduced wait times for surgical procedures and better access to anesthesia care are byproducts of the permanent full practice authority to VA nurse anesthetists. The VA Office of Inspector General identified that 28 VA medical facilities reported severe deficiencies of anesthesiologists. This accounts for a 22% anesthesiology provider shortage in the VA administration facilities. So the lack of anesthesia providers reflects especially on the horrendous wait times that veterans have to go through to receive anesthesia care. On average, a veteran might wait up to 90 days for surgery or any other procedure in some regions, and with an average of 3 to 6 weeks, sorry. So implementation of full practice authority brings forward the opportunity for CRNAs to fill this gap, this provider gap and this deficiency, and minimize the unnecessary wait times and maximize the quality of care that our veterans deserve. Additionally, veterans who simply cannot wait weeks to months for anesthesia-related services must seek treatment at non-VA facilities. This creates a financial burden for the VA system, as care at private hospitals and state hospitals cost more. And veterans are entitled to apply for a VA to cover these costs because it's part of the benefits package. So anesthesia care provided by CRNAs has already been proven to be more cost efficient than care solely provided by anesthesiologists. Full practice authority for nurse anesthetists can also decrease the cost for the VA system by minimizing outsourcing of anesthesia-related services to private and state hospitals. So there are approximately 900 CRNAs in the VA system to date. Granting them full practice authority will significantly proliferate the access to surgical and anesthesia care that the VA could offer their veterans.
Excellent, excellent. So far what I'm hearing here is nothing but benefits. Austin, there are some people out there, though, that would say that full practice authority for CRNAs might be harmful. What would you say about that?
Yeah, Michael. So the American Society of Anesthesiologists, also known as the ASA, and other physician-related entities are the biggest proponents to passing a legislative or policies regarding CRNA practice. So in 2016, when the VA initially let APRNs practice, they were set to include CRNAs. The ASA actually stepped in and was like, no, you can't include CRNAs, citing basically their job security and saying that, they're more qualified to take care of these patients. They can't have CRNAs just taking care of them with no physician present. The backing that they use is that they have more clinical hours and more education and all of that sorts. But the issue is they get a lot of experience. They run ICUs, they perform general surgery, inserting chest tubes and thoracentesis and other medical procedures that CRNAs are not trying to do. Another backing of them was WHO, the World Health Organization, the Federation of Society of Anesthesiologists, which is another group backed by their own peers, that's their supporting for physician oversight in these surgical cases. So that's a huge challenge, is that the influence that the VA affairs allows them to have on their policy, and not just the VA, the United States as a whole allows this organization to influence them and other states that haven't opted out and allow CRNAs to practice fully. And as Lindy talked about, this CRNAs, it's not known what we do. The public doesn't know what we do and the training that we have. There was actually a couple of days ago, Steve Harvey on Family Feud made a joke about CRNAs. He actually came out, this woman said that she was a CRNA, and he asked a nurse anesthetist and asked what that was. And she was like, I give, anesthesia during surgery. And he was like, and she's like, we don't have anesthesiologists. And he was like, oh, so if you go there, you want to die.
Anesthesiologist is a doctor anesthetist, and I am a nurse anesthetist. So I still give anesthesia here, but I'm not a doctor.
Yeah. In other words, if you come to her hospital, you could die.
The joke fell flat because, it wasn't funny. But, the public and legislators, they don't know what we can do, how serious we take our jobs, the serious education and clinical hours that we have. So there just needs to come to understanding that anesthesiologists, we're not coming for your jobs. We just simply want to provide services to underserved communities. And the veterans are in underserved communities. Their homeless rates are extremely high, their suicide rates, their mental health, everything declines. And then we make them wait for surgery just because an anesthesiologist can't be present. We have ample CRNAs, as David Perez mentioned. So that's just one of the biggest challenges for legislators, is to allow CRNAs to go that route. And an additional challenge would be, like, if we were to pass this, CRNAs, we just have to be ready, you know, to step up to the challenge. They're going to be watching closely, both the VA and the ASA, any little thing that they can say that it's not safe when it is. And so, yeah, that's our biggest challenge to date.
Thank you very much, Austin. Well, guys,
Mike, if I may, you know, it's interesting, and following up with Austin, what he said, like, these organizations do have a very large leverage on what he said on the Senate floor, when it comes to passing acts like this to try to improve full practice acts for CRNAs. And one of the biggest lobbyist group is the Physicians for Patient Protection. I mean, they have this old school rhetoric that is fueled by a fixed mindset, which I honestly, the only way to describe it is like a God complex. According to a report from MedPage, who interviews several physician groups that are part of these organizations, they didn't have like actual data to back up their claims. The reasons why they didn't want were based on morale. One of them stated that they believe doctors' morale has been suffering by this. And others, they said that they feel mistreated and undervalued and underrepresented in this situation, which is baffling. You know, to make matters worse, when I was reading the reports that they were citing, Mike, they're citing work from 2014. The latest studies from 2017 till today shows that CRNAs work at the same level as physicians. Listen, it takes a minimum, like Linda had mentioned, it takes like at least a minimum of 7 to 8.5 calendar years of education and experience to prepare a CRNA. This includes a bachelor's degree before entering the program, a year minimum experience in critical care setting, over 9,000 clinical hours combined. And now, in order to meet the complexity of healthcare and the growing body of knowledge, students will be graduating with a doctoral degree per the requirements of the American Academy of College of Nursing. Look, full practice authority for advanced practice registered nurses is necessary to transform primary care, and it will happen with them or without them. The question is, do they want to be a part of it or be left behind?
One thing I would add to that, so for the data that the anesthesiologists use to back up their claims, they're completely disregarding the Center for Medicare and Medicaid Services, the CMS, a report from 2010. So in 2001, that was when the initial opt-out for the nurse practitioners to go out and practice on their own. As of 2009, there were 15 states that allowed CRNAs to practice without physician supervision. And in 2010, there was a report that was backed and supported by the CMS that said there is no drop off in the quality of care. There's no more complications. There's not a higher mortality rate when there is just a CRNA present without an anesthesiologist. So that's what we're using actual data that shows the actual outcomes of the patients, and they are using their own judgment and their own opinions that they think has more value than that.
Yes, I think you're so correct. Everybody who has said something about this right now, this is how, just to educate the public about how this works, is that right now you have an anesthesiologist as you're attending, and they look over all the CRNAs who are in the OR that day. So CRNAs are getting put into cases by themselves. They're doing all the anesthesia care. They just have an anesthesiologist present at the hospital, not even in the room, at the hospital where they're working, to make sure that if anything does happen, that they have that extra backup. But most cases, CRNAs start and finish without an anesthesiologist in the room, and there's not a very high morbidity and mortality rate for CRNAs providing that care to a patient in the OR setting.
And just for the sake of bringing this around full circle, in regards to the VA and the VA healthcare, it's funny that they grant full practice authority to all their advanced practice nurses except CRNAs, when in the battlefield, foreign soil, over 90% of anesthesia care is provided by CRNAs. The CRNAs are the sole main provider of anesthesia care in the battlefield for the U.S. military. But So you're telling me that a CRNA can do this abroad under high levels of stress in the battlefield, but they can't do it in a controlled setting back home. It's kind of baffling to me. Additionally, when the VA get full practice authority to all their nurse practitioners and advanced practice nurses, they included some practices that they're not even part of. For example, they get full practice authority to midwives, and obstetrics is not a service that is provided in the VA. So it goes to question, you know, if it's not about providing full practice authorities to CRNAs because of the challenge or because of the threat that it's seen by the American Association of Anesthesiologists, and what is it? Because everything points to that CRNAs are more than capable of doing it. It's just food for thought.
Excellent, excellent.
Absolutely. Look, in like Michael, it all comes down to one simple thing. Like in these dire times when the country is facing multiple healthcare challenges that are evident, the opioid epidemic, the pandemic such as COVID, physician shortages, and lack of access, it is honestly difficult to justify the need to withhold full practice authority for CRNAs. I know the latest was Congress has granted the VA Secretary, Mr. McDonough, statutory authority to establish necessary provisions that support the VA's fourth mission. The VA's fourth mission is to improve national preparedness for war, disasters, natural emergency, as well as increase access to veterans. We all, as a message to all the legislators out there, we all must continue to work together on this matter to ensure that all American veterans, no matter where they live, or they receive the care that they deserve. We welcome the opportunity for an open dialogue to discuss the growing evidence that shows CRNAs are well equipped to meet the current demand from our healthcare system and help reduce healthcare costs while meeting healthcare needs through permanent full practice authority. That's our message, Michael.
Excellent. Well, I have 4 CRNAs here that are obviously at the top of their practice, true professionals. David, Lindy, David, and Austin, thank you all so much for coming in today. Did anybody have any final thoughts before we move on? All right, well, guys, it's been a pleasure having you here today. Everybody, thank you all for tuning in to Channel 13 News. I'm Michael Hernandez, your host, and I hope we see you again next time.